Hi, everyone, and welcome. I see we've got 45 people on the call so far. That's pretty great, having gone a month without talking with you all. I'm Melissa Southwick. I'm the director of the SASH program, and as always, I'm joined by Casey Dorner, our health systems educator, and this is our COVID call for April 5th. I have to say, in going through this, having not done it for a month, I actually paused on this slide and just reflected a little bit. We got into a point where it was pretty rote, and this was definitely a slide that was there, but we all knew it. And so just stopping to think about it, seeing if it needed to be redone, it just struck me as how poignant this really is. So what are the SASH priorities? We've got safeguard health, welfare, and privacy of SASH participants, encourage SASH participants to access regular medical care, mitigate social isolation and loneliness, and maintain the fidelity of the SASH program. It struck me as interesting because those are pretty much all things that we touched on for the slideshow today. So I think we're right on track with these. I don't know that they need much updating yet, but it was good to review them and kind of think about them with fresh eyes. Things we're going to cover today. As always, if you don't see something on here that you were hoping we were going to talk about, please put it in the chat. We will do our best to get through all the chats. We're going to talk about current trends and data, well visits, vaccines, the COVID talk, group programming, next steps, and more. Those are the big key takeaways for today. So I'll start us off like I always do with the data. Really surprised in the number of positive cases here in Vermont, up to over 20,000 now as of yesterday. Up until November, we were under 2,000. And so literally just since November, we've gained 18,000 cases, and that kind of blows my mind when I stop and think about it. We have 229 deaths. It looks like Minnesota has over 500,000 cases with almost 7,000 deaths. And Rhode Island has 138,000 cases with 2,630 for deaths. What's not on this slide, and I guess we could add it, but are all the people that have recovered. And I mean, those are in the millions. So this slide feels very negative to me when I know that there's millions and millions of people who have gotten this and recovered. Or hundreds of thousands anyway, I'm sorry. It just feels like we're focused on some negative things here, and I'm wondering if we shouldn't change that. But for Vermont, for SASH, we're showing that we've got 152 negative tests coming back, 53 positive tests. My guess is that we've actually had a lot more people get tested than that, and that's just all that's in PHL right now. We're showing 3 total deaths associated with COVID-19 in PHL right now. Talking about PHL, we know that in Vermont, 77.6% of people age 65 and over are vaccinated. And we know that we've had really great success getting our SASH participants vaccinated. Right now, those efforts are just not showing up in PHL. If you look at the numbers in PHL, it looks like we have 50% of SASH participants documented with a first COVID vaccination and 38 documented with a final COVID vaccination. My guess is that those numbers are actually much, much higher, and we're just not seeing it flush out in PHL. We do want to encourage you to put the COVID vaccines into PHL if you can. We do an amazing job capturing flu, pneumonia, and shingles. And I know this is new, but we're really hopeful that we can do that same level of tracking for COVID vaccines. It's really helpful, not just for funders or grants, but we were talking about it in our admin team today, and I think for staff turnover, it's really helpful too. You may have hosted a flu or a COVID vaccine in your site, and you might know everybody that got it, but if you left tomorrow, that information would go with you. And so for staff turnover, entering this stuff into PHL is going to be really important. And then somebody had an amazing idea, and I wish I could remember, I'm sorry, I can't give you credit, but for actually offering to scan the COVID vaccine card that you get and upload that into PHL as well. That way, if anybody loses their card, we'll have a copy and we can just print it off for them. I thought that was an amazing way to use that scan feature in PHL, and I would really encourage you to do that for anyone that is at all concerned they might lose their card, or for anyone that wants you to. If you have questions about how to do that, just reach out and we can help walk you through. If you haven't uploaded anything in a while, we can walk you through how to do that. Casey, you want to walk us through some of the national data?
Yeah, thanks, Melissa. And I'll add that it was Amy who had that great idea this morning. So thanks for that. And the other thing, and we'll talk about this a little bit more later with that vaccine data, is at some point we may need boosters. And so knowing when somebody had their vaccine and being able to look that up really quickly and what variety of vaccine they had may become very important in the future. So I think having that information in PHL will be super important. Moving to national, certainly there is a lot to talk about here. While cases were dropping significantly and are still significantly down from the peak in January, they are on the rise again. And there is, if you listen to the news, there's a lot of talk about, are we entering a fourth surge? Right now in the United States, there are a lot of hotspots. There's the 7-day average is an increase of 12% this week, with real significant spikes in Michigan and in the Northeast. So kind of all around us, New York, Massachusetts, Connecticut. There are 34 states reporting an increase in cases. Michigan, especially, is a real hot spot with a 57% increase in cases over the last week and 104% increase in hospitalizations. In Michigan, as in most areas, this is really being driven by young, unvaccinated adults. In Michigan, they have vaccinated 17% of their population, and they're still having this huge spike. So certainly really concerning to watch there. We put both of these charts up at the top for today. One is from, I think I can see it, it's a little tiny here. This one on the left is from March 16th, I think it says. I think it's 16th. It's really tiny. And you can see the total cases on that day was 26,000. And that's, I'm sorry, no, the total new cases, thank you for making it bigger, was 49,000. And today's report, the total new cases is almost 68,000. So a significant increase in cases in just the last 2 weeks for that national data there. Thanks, Melissa. It's even more scary when you look at what's happening worldwide. There are lockdowns in much of Europe. England is just starting, the United Kingdom is just starting to come out of a 3-month lockdown, which started in December. There are record numbers again in India. You may remember back on our webinar in early February, we were talking about how interesting it was that cases had all of a sudden dropped off in India, and they were looking for reasons why all of a sudden that line was going straight down. And now India is surging again and is one of the highest countries in the world with cases. Also huge increases in cases in Latin America and the Caribbean. Brazil is leading the world in new cases every day. And there are big increases and surges in parts of Africa, including Kenya and Ethiopia. Closer to home in Ontario, Canada, they're seeing a dramatic increase in hospitalizations and deaths. And part of that, as in most of the world right now, is being driven by the variants. In Ontario, they are reporting over 50% B117 variants in their cases. So lots of increased growth, lots of concern about what that's going to look like in this country over the next several weeks, and with real hope that we will not see the same surge because of the vaccines, because we have so many people vaccinated, and especially that we won't see as many deaths and hospitalizations because of the vaccines. The next slide just is kind of a heat map and gives you a little bit of a visual as to where things are the worst. And the dark red is where transmission is high, orange is substantial, yellow is moderate, and then blue is low. So you can see Minnesota, Vermont, and Rhode Island are all in that red area. Cases have certainly increased in Vermont. I would say this is the first time on one of these calls where I'm actually in a hotspot, where Caledonia County is one of the hotspots in Vermont right now. And then the variants. So B117, as I said, is the biggest concern at the moment, though the other variants are, they're certainly watching them, and a lot of concern about those in other countries. As you can see, that number of reported cases in the US has really grown. There's over 12,000 cases, and that is really just the tip of the iceberg, because it's just cases that are being caught. But right now, Vermont has 12, Minnesota has 526 known cases, and Rhode Island has 7 known cases of the B117 variant. I believe this is way underreported for a couple of reasons. One is we're not doing a huge amount of testing for the variants, but also, like, for example, in Vermont, locally, we've been told of more cases than that. It just maybe hasn't reached the CDC website here. A couple reasons this is really a concern. B117 is between 60 and 100% more transmissible than the original variant. It is also reported to be 50 to 60% more serious, or have more cases of serious illness and death with this variant. And one of the biggest concerns is it's more transmissible in children, in kids. So whereas before, kids could certainly get it and they could spread it, but they didn't seem to be the biggest drivers of the surges or the outbreaks. With the B117, they're seeing a lot more outbreaks connected with kids, with schools, with daycare, that kind of thing. Before we move on into vaccines, I just wanted to pause for a second, make sure there weren't any chats or questions on any of that.
It looks like we just got a question in from Susan. It says, my question was about the surge connected to variants. In Quebec, they are talking about a link with children who are unvaccinated. What are the current updates or recommendations when we are vaccinated and our children are not? Are they possibly carriers and transmissible to us, even if vaccinated, therefore to the community? Oh, and it's Giselle, sorry.
Yeah, that's a great question. We do now know that the vaccine is going to prevent you from getting the virus. But it's not 100%. So there are what's being called breakthrough infections. So in Vermont, there's been more than 25 breakthrough infections in fully vaccinated people still getting the virus. And you still can be an asymptomatic carrier. So having your kids potentially get the virus, bring it home, give it to you is still a possibility, but you are much, much more protected now that you are vaccinated. So there is still some risk. It's never going to be, I shouldn't say never, well, hopefully someday we'll be risk-free with COVID, but right now the vaccines is what's giving you the most protection. So the kids are definitely carriers, and potentially you could be as well, which is why you still need to get tested if you have an exposure or if you have symptoms.
Yeah, and we're going to talk more about that later too. April was wondering if we know if children are more prone to death with the new variants.
There's lots of research going on about that right now. Children are certainly getting it a lot more, and there is increased seriousness in all people who get the B117. Some of the other variants may be even more concerning. B117, I think, right now the death rate for B117 is like 0.02. And so when that has doubled, it goes to 4. So it's still minuscule. But they're certainly looking at that. I don't have a complete answer for that for you yet.
Yeah, and I think for Giselle's questions that are still coming in, we're going to talk about that more. So I'm going to move us along just because we do have a lot of slides to get through. But there is more coming on that.
Yeah, and I think that the short answer is if you have symptoms, you should get tested, regardless of whether you've been vaccinated or not. If you're having any symptoms, go get tested. Absolutely. This is a slide shared with us by Dr. Levine, and what I think is wonderful about this slide is it really shows that the vaccines work. So you can see how much the infection rate in people over 70 dropped once vaccination started. So that is super, super exciting, that 81% decrease in the infection rate in people over 70 since January. So, super exciting about that. Next slide.
Casey, there was another question that came in too, and I think it's similar, but concerns about why people are testing positive and after having been vaccinated, and understanding that you still need to wear the mask and socially distance. So Sarah's asking if we have any guidelines to help share that they could use to protect themselves. I think honestly, the guidelines haven't changed. I think maybe we could update it to say, even if vaccinated, you should still, that might be something that we could add to the current one-pagers or posters that we've put out. But the guidelines are still the same, vaccinated or not, keep 6 feet distance, mask, you know, if at all possible when you can. I know they're saying like you can have a dinner party and not mask, but I don't know, Casey, what do you think? Any other guidelines we can add to that? It's so weird because it does kind of waffle back and forth between you should keep distance out in public, especially you should keep distance, you should mask, but you can have friends over for dinner.
Yeah, I think a lot of it is about protecting the public right now, because a huge amount of our population still doesn't have access to the vaccine. And so we need to, even those of us who are fully vaccinated, need to continue to protect those people who haven't been able to be vaccinated yet, or can't for some medical reason.
Great, thank you. And yeah, we can definitely work on a poster. So we're just going to share with you what the vaccination registration is looking like right now. So last week in Vermont, vaccinations were open to the BIPOC community and their families of aged 16 or over. And then also last week was open to adults with children with high risk conditions. But you can see where we're at with the current openings and where we're headed. It looks like age 40 and up is supposed to open today, and then 30 on April 12th and 16 and up on the 19th. For Rhode Island, they have this chart that kind of shows you where they're at right now. And it looks like they're at age 50. It looks like 59 to 60. Maybe that's 50 to 60. I can't quite see it. But if you are in Rhode Island and you want more information, this is the website that you go to, the RI, Rhode Island COVID-19, when can I get my first dose? And it will actually tell you, you can click this as a live link, who's eligible this week, and it breaks down. There's a whole, you can go through and you can be like, I'm a healthcare worker, yes, I'm this, no, and it'll give you really specific guidelines around if you can or cannot get the vaccine today whenever you click on it. It's a great, I wish I could have figured out a way to share it, but it was too long. It's a really great website, the way they have it worked out. And then Minnesota, every Minnesotan age 16 years and older is eligible to get their shot. So by Tuesday, March 30th, they were able to say they were opening it up for everyone. So not general public, open, 16 and older, not much left to really discuss there. That's amazing. They're doing a really great job with their vaccinations in Minnesota. And there's also a website you can check that out on as well.
So a quick update on other vaccines kind of in the pipeline. AstraZeneca has got a lot of press over the last month. It's been on hold and then back off hold in many countries. And the concern there is around blood clots. There have been over 17 reported deaths from blood clots potentially associated with the AstraZeneca vaccine. And this was expected to become an issue with the vaccines. It hasn't necessarily been handled particularly well by the AstraZeneca company, but because we would expect a certain number of people to get a blood clot and die from that on any given day in the world. That happens. So connecting that with a vaccine is what's really challenging. And there's a huge amount of research going on right now where the World Health Organization and the European agencies that are looking at this have mostly landed, is that the risk of a blood clot is so low and the risk of getting COVID-19 and dying from that is much higher, that this is approved, and they're pushing people to continue to get the AstraZeneca vaccine. AstraZeneca is going to have a huge impact on the vaccine that's available worldwide. They have, or are in the process of applying for emergency use authorization in the United States, and expected to hear soon about that. But the messaging around this has been kind of detrimental to the vaccine rollout in general, that people already are a little hesitant in some areas, especially, and concerns about safety. And so getting a lot of press about a safety issue has been challenging for all of the vaccines and for the rollout in general. So hopefully this can get resolved, and they can figure out what that connection might be, so that we can continue to have positive press around the success of the vaccines. Next slide. So as far as vaccination data, like Melissa mentioned, in Vermont, over 77% of people over 65 are vaccinated. So that is really huge, especially with the surge in cases that we're seeing right now. In the general population of Vermont, over 24% are vaccinated. And nationwide, 71% of people over 75 are vaccinated. That's going to hopefully really protect us in this potential next surge, and keep the death rate lower for people over 75. Nationwide, about 17% of the US population is fully vaccinated. Minnesota has 19% of their population fully vaccinated, and Rhode Island has around 21.5% of their population fully vaccinated. The hope is that nationwide people over 18 will be eligible by May 1st and get a lot more people vaccinated. There is the biggest issue right now in a lot of areas is becoming vaccine hesitancy, so that there's enough vaccine available and there's not as many people willing to get it. So a lot of push, but locally and state government and national government really pushing education campaigns out there to get more people vaccinated right now.
Casey, I would just add that the one thing to take note is just that where it talks about the total population, I have not seen anything where they're taking into account the fact that people under 16 can't get vaccinated. So they're really looking at the total population of Vermont, the total population of the US, Minnesota, and Rhode Island. They're not looking at the total people eligible. So right now, those percentages would never be 100%. Because they're not able to vaccinate people under 16 yet. So just to note, that's the one thing that stood out to me in looking at some of that data.
Right, absolutely. And before we can really get to herd immunity, we're going to need to be able to vaccinate people under 16. And so there is a lot of work both by Pfizer and Moderna on testing in kids and trying to get a vaccine ready for kids. Next slide. So I think one of the priorities right now, we're going to switch away from the data a little bit and turn more toward the SASH work, is around well visits. A lot of our participants have not been to their doctor in the last year. So they haven't had those checkups that are so essential. They're essential for all of us. They're essential at every age, but especially with participants with chronic conditions. It's really, really important that they make their well visit with their doctor. And they should do it as soon as they can, and get these checkups. It's blood work, it's vaccines, screenings, reviewing their medications that they maybe have been on for over a year now, and are they still the right ones and at the right dose, getting their A1C checked. All of those things are really, really important to happen every single year. So check in with your participants, make sure that they are talking to their doctor and get an appointment set up.
Thanks, Casey. The other question we've heard a lot about is group programming and when can group programming restart. And you might remember, I pulled this from the slideshow on May 5th or May 4th of 2020. So almost 11 months to the day. We tied this to the governor's orders allowing for the resuming of congregate and social activities for older adults or vulnerable populations in our phased-in approach. So, it's time to stretch, everybody. So as it turns out, that is happening now. So we want to kind of talk about that because it is really clearly in our phased in documents, and we want to sort of talk through that and what that means. So I just want to start off with what is Dale? I think that it's an assumption that we all just know what Dale is, but we talk about it quite a bit, and I wanted to take a minute to just sort of level set on what that is. So Dale is the Department of Aging and Human Services. It's under the Department of Aging and Human Services. It stands for the Department of Aging and Independent Living. They oversee many divisions within the state government, such as Assistive Technology Program, the Developmental Disabilities Services, Division for the Blind and Visually Impaired, the Division of Licensing and Protection, and the Division of Vocational Rehab. But the one that's most relevant to our work with SASH is the Adult Services Division. So the Adult Services Division is responsible for all of these different programs that I'm sure you've heard of through your participants and the work that you do with them. You'll see on the top there, the Adult Day Services are overseen by Dale. And so Dale guidance for senior centers or adult day services recently came out on March 30th, and they're saying that they can reopen. So we said when they say they can reopen, we can start group programming again. I'm not sure it's all that simple, but we'll talk through it. So there are some exclusions. They're saying that anyone showing symptoms of COVID should not be going to the adult day center, anyone who's awaiting results from a test, any unvaccinated individuals who are requiring quarantine, so maybe who've left the state and come back, and then fully vaccinated staff and volunteers with known high-risk exposure as staffing capacity allows are all excluded from the you can come back sort of guidelines. The thing that's really helpful is that there is a frequently asked questions on this website up here, and we send out or we'll post the slides to start afterwards so you can see that link. But things like, and we just pulled a couple that we thought might be interesting. So can people take masks off if doing exercises? It says per the mask mandate, mask or cloth facial coverings are not required when someone's engaging in strenuous activity, when physical distance of 6 feet can be consistently maintained. Doing any strenuous activity outside will lower the risk. If people are able to wear masks, that also lowers the risk. Can people make their own coffee? Yes, it's recommended that you wipe down any frequently touched surfaces between participants. These are all, again, the Dale recommendations for adult days to reopen. We have classes offered in other locations such as church. Do these follow the same guidelines? And they're saying that the guidance is similar to what the health department would provide other organizations. And then what do we do if staff, volunteers, participants refuse to be vaccinated? Can we require vaccination? Can we require people to show their vaccine card? And so basically the health department has said they're not a regulatory agency. And so they and Dale both recommend reaching out to legal counsel regarding requiring vaccination and requiring that participants show their vaccination card. SASH, we're also not requiring vaccination. However, anyone who is not vaccinated must follow the state guidelines for non-vaccinated people, including avoiding gatherings, no travel, and quarantine as needed for exposure. Additional Dale guidance. So these are just some other things that we thought really kind of spoke to this. You have to post signs at all entrances indicating that no one may enter if they have symptoms of illness. You probably already have those on your doors, just leave them up. Intentionally and persistently combat stigma around not getting vaccinated. A negative test represents one moment in time and does not change any of the health standards regarding infection prevention. Participants and staff are fully vaccinated when it's been 2 weeks since their final dose. Fully vaccinated individuals should still be screened for symptoms and should not enter the adult day center if they have any symptoms of COVID-19. And then even after vaccination, everyone should continue to follow all of the current guidance to protect themselves and others, including wearing a mask, staying at least 6 feet away from others, avoiding crowds, and following something. I guess that got cut off, but it's the governor's orders for all of those guidances. And then we've got some group programming best practices, but the long and the short of it is basically what we think is that you're going to have to work with your panel to decide if and when you can open group programming. You're going to have to work with your coordinator, your wellness nurse, your supervisors, the housing agency, and decide, are we ready to open this group programming? What does it look like here? And so I know that that's what Cathedral Square has been doing. Cathedral Square is going to start hosting some small programs and basically work out from there. So definitely talk to your supervisors, work with them, and please don't just assume that we're saying, yes, go do programming. We're saying you can start considering cautiously doing some programming. So some of the best practices are, go outdoors when possible. It's about to be warm, like maybe wait 2 or 3 weeks and just start all your group programs outside. Start small because you still need to socially distance. So, small groups of people getting together, make sure that you're distanced, there's airflow, wear masks, hand sanitize, still probably don't do food yet. Plan activities, this is straight out of the guidance, plan activities that do not require close contact or between multiple participants, like cards. Maybe if you're going to do singing, do that outdoors. Take attendance and keep a record. This is the most important thing. If you all go forth and decide we're going to start offering some small group programs, make sure that you take attendance of who comes and what day they came, because that's going to become pivotal if there's a contact tracing that needs to happen. And then sanitize chairs, tables, doorknobs, equipment, both before and after the program. I'm just going to pause there because that's a lot of information, and I want to see if anybody has any questions before we move on.
To add that all the guidance, it's about a 14-page document, is on the Dale website. So feel free to look at that and read through that. We just kind of pulled out what we thought was most relevant for SASH. There's lots there.
Right, and it's the guidance for adult days. So even though we're saying like our group programs are somewhat similar to an adult day, obviously not all of the guidance on there is going to be a direct correlation to our work. So if you see something on there and you don't know if it works for us or not, just reach out, ask. We'll happily help walk through it and try to figure it out with you. And then we've got a question, is it okay to go slowly with this and not rush to organize and plan too many activities? Can you email this one page to us, only for the vaccinated? So yes, definitely. I think this is going to be a slow process. We're going to start small. We're going to, but we should start. I think now is the best time that we need to be starting these back up, because again, if you go back to the very first slide about what are our priorities, a lot of our priorities can be met with these group programs. It's such a pivotal part of SASH, and we really need to, now is the right time to start thinking about restarting these and getting these going again. As far as the only for vaccinated, Kenneth, we can't necessarily answer that because VDH can't answer that and Dale can't answer that. Are you allowed to say only people that are vaccinated? So what we're recommending is that you say, we're inviting vaccinated people to come to this group program, and then see, we're hoping that people are going to follow the guidance. Here's what the guidance is. Here's who we're opening this up to. And know that if you're coming and you're not vaccinated, you are putting yourself at risk, because you as the unvaccinated person are going to be the one that may then end up having COVID. So the unvaccinated person coming to the group doesn't necessarily put the rest of the people at risk, but it does put themselves at risk. So just making sure people understand the risk if they come when they're not vaccinated. And a walking group would be absolutely great, Jen. I say start that tomorrow if you can. That would be wonderful. Okay, so keep the questions coming in. I'm gonna move us on so we can get through all of it. Oh, Casey, sorry, this one's mine. So the recommended cleaning. So the following products may be used for disinfectants: the diluted household bleach solutions, alcohol solutions with at least 70% of alcohol, most common EPA registered household disinfectants, and then C-list N disinfectants for use against SARS-CoV-2. Those are all, we have a list on STAR too from back in the day of all the different things that work. So I would recommend just looking at that list and making sure that you're using one of the appropriate cleaning solutions. And then screening staff and participants. So you still want to do screening, especially if you're going to have people coming into a group. Do the temperature check. Ask if they've had any recent exposure to someone with COVID-19 in the last 14 days, even if vaccinated. any symptoms of COVID-19, and then are you waiting for a COVID-19 test? So these are the common screening questions. These are what was recommended for the adult days. I would say feel free to use these for group programs. And if anybody asks, you can say this is the guidance that groups are, are being given, asking these questions. And then Casey, you were going to talk about risk.
Yeah, thank you. So, we are getting to a place with vaccines anyway, where our risk is lower. We're not at high risk as staff going in, visiting people. We are, in addition to our masks and our face shield and our and staying back from people, we're more protected because we have the vaccine. But there is still risk, and there is always going to be some risk. So the tolerance of a person's risk is going to be very much an individual decision and something you need to talk with your supervisor about. But just to keep things in perspective, because watching the news, listening to me talk about what's happening in other parts of the world, all of those are kind of anxiety producing and makes us think that there's a lot of danger. So I think it's important to remember that every year we have between 12 and 61,000 deaths in the United States from the flu. But we don't require people to be vaccinated for the flu. We don't stop our group programming because there's flu in our community. We don't even do temperature checks when we have a class. So, and we do get it, and our participants get it. And so keeping that in perspective, and our work is just never going to be risk-free. We have, just getting in a car is a risk, and we have risks from our participants' pets and from the ice and their old porches and their old steps, and from other infectious diseases. We are constantly exposed to all kinds of things, from bed bugs and head lice to C. diff and MRSA infections. So there is always a level of risk, and if nothing else, COVID has taught us how to mitigate some of that with hand washing and masks and that kind of thing. So a lot of this is really very much about assessing your own risk and finding a balance. So next slide.
Oh, Casey, can I stop for 1 second? We have a few questions. I know that, you want me to go to balance first and then we can go through questions since they kind of go together?
Sure, yes, why don't we do that? It's really about balance. Finding, getting informed and staying informed from a really trustworthy source. And we're going to share some suggestions at the end of this webinar. Finding a way to trust the state guidance, that's really based on science. So they are, so listen to that state guidance and trust that that's in your best interest. Talk to your healthcare professional to help you understand your own personal risk, because everybody, like I said, everybody's very individual. But right now we have, in most cases, we have 2 vaccinated people, you and your participant, visiting for less than 15 minutes and being more than 6 feet apart with masks on is really as safe as we can possibly be right now. So keeping that perspective, and my mother wants to come and visit me, and she's fully vaccinated, so she's trying to calculate her risk of coming, and that's a 2-hour drive. In some ways, there's a bigger risk of her dying in a car accident driving to see me than there is of her dying of COVID because she comes to see me. So being able to just think about risk in that way can be really helpful. But as we move forward, and I think this is going to be especially important over the next 2 weeks if we get into a real surge situation with a lot of cases and a lot of media and a lot of fear around cases in our communities. But remembering that our participants and most of our staff, though certainly not all of them, are protected and vaccinated at this point.
And Casey, you mentioned on the slide with the chart that kind of split off, and I think it's really helpful because we are hearing about more cases, but that slide to me, that graph shows that our participants are at less risk now than they were before vaccination. So vaccination does work. And I think that just remembering as you hear all of this news about the cases are increasing, it may not mean necessarily more risk for our participants. the questions that have come in, Kathleen Braun had asked about getting a forehead thermometer. I know, Kathy, we don't have any more funds to give out thermometers. We purchased thermometers for all of the nurses last summer. We will always be on the lookout for more funds to help with things like that, but for right now, we don't have any. So I would talk with your supervisor and see if that's something you can get. There are pretty good ones on Amazon for relatively inexpensive. I think that the ones that we bought were around $50, maybe even a little less. And then April was wondering about, and I don't know if we're able to speak to this or not. If not, maybe we can give a good resource that could, but can you speak to the latest data on asymptomatic transmission of COVID-19 of people who are vaccinated? And I think that question came up earlier, right, in the call, and I don't know that we have much information on it.
Yeah, I don't have any hard data for you on that, April. I think it's definitely possible to get the virus if you're vaccinated, and if you can get it, that means you can transmit it. But there has certainly not been, as was initially feared, there has not been very much asymptomatic spread by vaccinated people at this point. But I don't have the hard data on that. We can certainly look for it. So Dr. Levine has mentioned a few times on the press conferences about having the COVID talk. So we wanted to take you to the VDH website just because it shares some really good language that might be helpful for you or for participants around the COVID talk and how to have that conversation with people. So Melissa, if you can get to that site, we can kind of click through these. So this is on the Vermont Department of Health website, but it's certainly relevant for Minnesota or Rhode Island because it's not, this is not state specific, this conversation that you can have with folks.
Are you able to see my screen?
Yes, thanks. So scroll down a little bit.
Get there, hold on.
So April, April's question is, or her follow-up comment was, thank you. As a parent with kids under 16, that's my biggest concern and barrier to service at this time. The concern being the potential of being an asymptomatic spreader. So there's a couple of things you can do with that, April. One is to get tested yourself anytime that you want to do that. There's still lots of testing out there. But remember too that you are, for the most part, visiting people who are also vaccinated, and that you're wearing a mask. You can still wear a shield, you're staying 6 feet apart, you're keeping your visits short. So all of those things combined is what reduce the risk. So even though the fact that you have young children may make it more likely that you would potentially have the virus and be an asymptomatic spreader, by doing all of those other things, you're protecting your participants as well. So I think we are there. Where is the, keep going down, I think. So, yeah, keep going down, Melissa. It's a little bit farther down. Sorry, I wasn't watching where you were at. Because these were some specific, yeah, there we go. Up just a little bit. So, when you are talking to friends and family or making plans to talk with friends or family, there's a lot to discuss. And so this just gives some ideas on how to negotiate boundaries and establish those ahead of time. So the first part is to ask questions and to get a feeling of what's going to happen in that visit. So, so before you get together, to have an open and honest conversation with everyone to kind of find out what if they've been following the guidance, how they've been socializing, and to hear other people's worries and boundaries and get on the same page. And these are some examples of what you might want to say, like, would you be up for a walk this weekend? Let's bring our masks. I recently got together with friends. We were pretty safe, but we weren't able to stay 6 feet apart the whole time. Do you still want me to come? Or do you want to wait a couple of weeks until it's safe? So just some examples, and you can certainly explore this more. But then the second part is to focus on what you need and being able to use I statements instead of you statements. I'd feel better if we could all keep our masks on. if we need to go inside, or I feel more comfortable meeting with you outside if that's okay. I've only been visiting places without a lot of people. So using I statements, saying why it's, and then the next part is to share why it's so important to you. Give Melissa's internet a second. And this one is if it's not, it doesn't seem to be waking up there. Did you click on share why it's important to you already, Melissa? Yeah.
Can you hear me, Casey? I did.
Okay, so it's just being slow. There we go. So all kinds of reasons but it helps when you have a reason behind your boundaries. So I have diabetes. I'm not taking any chances with getting COVID. I'd love to see you, but only if we can be outside. Or my kids are back in school and I don't want to do anything to jeopardize them being able to be in the classroom. So I can't afford to get sick. I need to be able to work. I need to keep my risk low. Again, making it about you or the participant, making the participant be able to say why it's so important to them, and then some suggestions around those boundaries. To do it in kind of a friendly, non-judgmental way, but without skimping on safety. I would go down just a little bit.
Sorry, Casey. It says,
okay.
Can you hear me? So for set the boundaries, it says thanks for the invite, but I'm going to pass this time. I'm not comfortable being around groups of people right now. I know you don't hang outside today and that's okay, but I don't feel safe getting together indoors. Let's try again another day. And then, whoops, this is a little too crowded for me. I'll come back another time. And I apologize. My Zoom is definitely not loving me right this minute. So are you able to see the slide? Are you able to see the slide deck now?
Yes, we're back to the slide deck.
Okay.
Right. So there's a link to that site there. I just wanted to share that. I think providing our participants with language is sometimes a really valuable tool for them to be able to talk to their neighbors about why they don't want to meet them for bingo right now or whatever it is, or work on the puzzle, but to have some real good language around that. So that's where you can find that. So we now need to really learn to live with, oops, we just lost Melissa. Amy, you want to pull up the, I guess moving back and forth was too much for her.
I'm doing it right now, hold on.
Okay.
This is why we have backup, right?
That's right. So clearly we're going to be living with COVID-19 for a while still. This is not going away anytime in the near future. Between the variants and everything that's with a potential fourth surge, we need to figure out how we're going to live with this virus. And one of the things, as I mentioned earlier, is we really need to address the long-term effects of the pandemic on our participants. So addressing mental health, social connections, that kind of thing, getting them in for those well visits and helping them manage chronic conditions that have maybe taken a back seat over the last year. We really want to take advantage of safe periods to connect with participants. I feel like right now is a safe period in Vermont, though that may be changing rapidly with increased cases. But especially since since so many, I should say, of our participants are fully vaccinated, and they're probably at their highest protection right now. All of you need to keep monitoring your area, stay up to date on the state orders, monitor your local cases and your local outbreaks, monitor the news about variants that might compromise the vaccines. You know, if we have more variants circulating that compromise vaccines, that's going to increase risks for participants who are fully vaccinated. So we'll need to monitor that. So I know we talked a lot today about group programming, and so we're going to hopefully be starting that up, but group programming right now is essential. Whether it's in person or not, it depends on what's happening at your panel and how safe everyone feels. But continue to expand and explore the virtual opportunities. Keep working on that. A lot of folks have the iPads now. don't put them away. Keep using those, because we need to expect that this marathon is hopefully about half over, hopefully more than that. And there still are going to be some episodes of kind of sprinting in the middle of that marathon. But we need to expect that this is going to continue for a while. So I think our next slide is an example of a virtual program that we just learned about, wanted to share. This is a activities group for older Vermonters. It's a game and social night hosted by COVID Support Vermont. So it's a way to connect and play games. I think it's via Zoom, but and this was posted on Star, right, Melissa?
Yeah, it's in the announcement section. So it's on the homepage if people look under announcements.
Right. And there's lots of other examples on there too, lots of other opportunities. And the next slide. So what comes next? I think that what we decided as far as these calls is that this was going to be our last COVID call for now, but you might want to hold the first Monday of the month for May. And if there's a lot going on or a lot changing or new guidance, that we would let you know if we were going to hold another call. And kind of longer term, we don't know yet how long the vaccines will work. Initially the CDC has said 90 days as far as how long you can travel and don't need to quarantine. New research from Pfizer is saying closer to 6 months, so twice that long. And basically that's just because they don't know beyond that it hasn't been around long enough to test it. So that's ongoing, and hopefully that will keep getting pushed longer. But people may need booster shots. Variants may emerge that make the vaccine less effective, and we may need booster shots because of that. And of course, the variants may increase the spread and the outbreak. So we need to continue to monitor that. Next slide. So this is just a list of ways for you to stay informed. The Vermont Department of Health does weekly updates. They do daily updates. Those are via email. You can ask to have those sent to you every day, or you can go onto their website and look at them. The Vermont Department of Health has a daily dashboard, which we've shared in the past, that will tell you where cases are and how many new cases there are every day in each county. The Vermont Department of, VPR, Vermont Public Radio, does a Vermont edition every Wednesday at noon and again at 7, which is a live interview and questions with staff from the Vermont Department of Health. So last week it was Tracy Dolan, the Assistant Commissioner of Health. People can call in and ask questions. They cover everything about the pandemic. It's recorded, it's a podcast, or you can watch it or listen to it as a stream online. So that one can be really helpful. And see, there's a question, do we know about other states? And so, Melissa, did you find anything? I know you were looking for Minnesota and Rhode Island.
It's the next slide.
Okay, okay. I'll let you speak to that one.
Sure. So I actually found these 3, and I know that the Health State Minnesota and the Health .hub Rhode Island, I go to every week when I plan these calls. The Department of Health websites for both of those states are really fantastic, and they have a whole slew of information. But I have to say, in Minnesota, the minnesota.gov/COVID was actually even more informative. That's where you're definitely going to find some of those infographics, those one-pagers that we were talking about. And I think actually for Rhode Island, it's a little different. The health department's where you're going to find that stuff, although the providence.gov does have some really good information around regulations. So it's almost like the opposite for those 2 states. And then 211 and United Way, both of them had really robust websites around COVID restrictions and also services that are available for people that are either quarantined or, a whole slew of things. So I would recommend all of those websites. And there's also a United Way Vermont website as well. So it looked like really good resources there. You could probably find everything you needed from one of those. And Casey, I would just add before we go on, I think maybe the quote of the day might be next, but we've given you some really spotty guidelines right now and guidance around group programming. And I think it's because we're just kind of learning as we go. So what I would say in, just to help support that is please go look, think about, talk to your supervisors, talk to your housing agencies, figure out what it is that you want to do. And if you have any questions, let us know, because we are happy to work through your specific questions with you. It's hard to give guidance for 22 different housing agencies. And so what we're saying is we really want group programming to start back up. We think it's really important. If it has to wait another couple weeks for you to get outside to do it, that's fine, but maybe try to do something remote. Group programming is really important. It needs to get going. How exactly you do that at each of your sites is probably going to be a little different. And so we can't just give you, here's what you go do. And if you have questions, we're happy to walk through that. To Diana's question in the chat, I would say that you might also want to pull up the governor's orders, Diana, or the guidance from the state, because any public spaces are still required to wear masks. And even though it's an apartment building, within her own apartment, she does not need to wear a mask, obviously, but when she steps out, it's in a public space, like your community rooms, your kitchen, all of that. So I would say that it's still the governor's orders that you're wearing masks in public spaces, and that might be another way to address that with her. I think we can go to the next slide, Amy, and thank you so much. Zoom kicked me off of our meeting.
So our quote of the week is from Mike Pichek, who's the Commissioner of Vermont Department of Financial Regulation, and he's also in charge of data. So he's on a lot of the press conference calls around data trending. And his quote from last Friday is, "We should recognize and acknowledge how fortunate we are to have the vaccine available to us, and how fortunate we are to have made so much progress protecting the most vulnerable, especially as we see this uptick in cases." And I felt like that quote really spoke to the place that we're in right now, which is this potential fourth surge, these growing cases, but also knowing that our participants have this level of safety and protection, and just feeling very grateful for that they are protected. A lot of our staff are protected, and those who aren't are hopefully able to get it soon. So feeling very thankful for those vaccines and the protection they bring us.
Thanks, Casey. I will send out a follow-up email to this. We had a couple of questions that came up looking for posters and things like that. So I will send out a follow-up within the next few days. I might have to do a little research, so it might not be immediate, but by the end of this week, we will have a follow-up email going out. And then like Casey said, if you want to hold on to that first Monday in May at noon, we may, we're not planning on having a call, but if anything changes between now and then that really seems to warrant one, we will. Thank you so much and have a great day.